Yeah, Claude, your robot has become a niche maker, really. The Baho nurse bot. I understand it's a robot that can take vital signs without human contact except for the patient.
Yeah.
Tell me about it. But first of all, before you tell me about your robot, tell me about how you got involved in the Timbuktu program.
Yes, sir. Thank you so much. My name is Claude, the founder and managing director of Baho Nursebot, a health tech startup that is manufacturing and deploying vital sign screening robots for early detection to reduce NCDs related complication and deaths. So we basically empower people to know their health status while sharing mass screening data to national and global health intelligence centers to contribute in terms of early interventions and decision making to reduce all those complications and deaths. So we really had an opportunity to be supported by Timbuktu program backed by UNDP. Last year, they rolled out a call of application, and by that time we were in a process of proving a concept, because we had that idea of contributing in terms of supporting people to take control of their health, and we had to go through research backed by interview and surveys with doctors and nurses in both urban and remote areas to really understand their pain point. So from there we had an opportunity to prove a concept. We deployed our first MVP and then corrected feedbacks from different users and early adopters.
Was this before Timbuktu?
Yeah, it was a bit before, but Timbuktu have really a great role throughout the journey, because after proving a concept with the support from Timbuktu, including mentorship, network with different stakeholders in terms of encouraging adoption for these solutions, but also funding, financial support. We had, it helped us to move from a proof of concept, and we produced 3 more robots, which are now being deployed in different places and improving accessibility, like for people to get their vitals checked and have different personalized insights, but also referring them to proper care.
In summary, would you tell me how Timbuktu made this process faster for you?
Oh yes, initially we used to work from Musanze. It's one of the places here in Rwanda, nearby famous Gorilla Mountains. Mm-hmm. And from there, it was a bit hard for us to source different materials and meet different stakeholders, because by that time we could meet someone who is really interested to interact with the robot, to learn more about how we do this and the mission we have. But it was a bit challenging for someone to drive 120 kilometers from Kigali just for a visit. So now we have an access to state-of-art facility with laboratories, electronic workshops, and different stakeholders, including these hospitals and clinics, including UN Clinic itself, where we can co-create these solutions with different doctors to really have the right solution for the problems they are now experiencing. So it was really helpful.
How did this come? How did it, I mean, what got you thinking? And how did you, end up with this solution?
Bajo Nurse Boat was born from a promise of a 10-year-old boy who was hospitalized for more than 6 months, all because his health conditions was detected too late. So through that painful period, he promised himself to protect other people from experiencing the same pain. So 15 years later, that promise became a mission, and that mission became Bajo Nurse Boat.
By any chance, Claude?
Oh yes, that child is me. This man here, yeah.
Oh, you had a personal experience.
Yeah.
And survived.
Yeah, sure. By God's grace, I recovered, but it was really hard because there were a lot of complications. So later, 15 years later, we started conducting all those research to really understand the pain point, and from there, we found out that there are many millions of people who don't have ready access to these basic healthcare services, including vital sign screening, because inadequate infrastructure, fragmented systems that leads to weak data sets in terms of policy making. So from there, we decided to work with different doctors and nurses, like to develop these nurse boats.
So when you say we, it looks like you had to collaborate with other people at some point for this to come true.
Yeah, sure, definitely.
You work with a team.
Yeah, I'm really glad for my team, like internal team. We have around 5 engineers, we have 3 doctors, 7 nurses as of now, and supporting technicians, but also different experts in different domains in terms of disease control, in terms of clinical setting or operations, in terms of public outreach, like this kind of mass screening and raising awareness. But also we have different partners, including UNDP, Timbuktu, and the government of Rwanda is very supportive. They have already expressed an interest to plug this solution to their National Health Intelligence Center through Ministry of Health. We've had great support from Rwanda FDA in terms of compliances, because we are dealing with sensitive data from people, and they have already provided a support in terms of co-creating with them and finding a way not only to comply with Rwanda regulations, but also internationally, because we are getting different interests. We have around 10 hospitals in the US with 15 senior centers, and a Norwegian cruise line that is operating in the US, but also India. They have already expressed their interest, and they are placing purchase orders. Yeah, sure. Yeah, USA, India, and 4 African countries. So in terms of regulatory compliances here, in terms of adoption and proving a concept to really fine-tune a solution to a level that can be deployed globally. We've had great support from different stakeholders.
So what prepared you for this? Was it your academic background? Was it just interest or just curiosity? I mean, mixed with your experience at the age of 10?
Yeah, it has been a very long journey, but also exciting, because there were a lot of ups and downs. I myself have background in electronics engineering, so I had to find people, right people, with passionate to save lives in different domains. And the biggest part was convincing like different people, doctors, nurses, engineers, data analysts, like bringing all those people together and share with them a vision and then build that sense of ownership so that we can join our hands and build this kind of solution. It was the biggest part, the hardest one. But now I'm glad we have a diverse team with different expertise, and we are not alone. We have an advisory board with different people with different expertise in terms of global collaboration, in terms of compliances, in terms of scaling, in terms of investment readiness. So all those people bring their ideas, bring their contribution to make this a success.
So tell me about this robot. I mean, here it is.
Yeah.
So how does
yeah,
how does it work?
It's very simple. With this robot, all you have to do is buying your digital card. It's now costing less than $1.
Produced by you?
Yes,
Okay.
digital card with all your informations, names, address,
Blood group?
your blood group, height, weight, and then with that digital card, you insert it here. The robot is able to autonomously move around the compound, like for instance, in a hospital, on a stadium, car-free zone, all those places, the robots are able to move around, and once they detect a person with an intent to test himself, we have like branded cards. Once they detect it with an intent to test, you plug it here, and this sensor and electronic scale down there, they extend. You stand on footprints on the boat, and then with the handshake, we are able to detect your pulse rate, oxygen saturation, and the temperature.
Just
with a handshake.
A handshake
Yes.
like this?
Yeah, like with this sensor, we are able to correct your pulse rate, oxygen saturation, and then from this side, we take your temperature, and then this was the first version, by the way, but for that second version, you put on a numb wrist cuff, still on this hand, and then we take your blood pressure. All those data, we correct them within 60 seconds, in less than a minute. Then we process them and give you an instant result via robot screen, your smartphone, or via SMS, considering our African context and smartphone penetration rate. So from there, we do all those processes while sharing mass screening data to the National Health Intelligence Center.
Can this analyze blood?
Yeah, the method we use is a non-invasive method. What we do basically is taking all those parameters, including blood pressure, and now for the second version, we are able to have your glucose level by using non-invasive technology. It's still under study by US FDA and different healthcare organizations. It's still under study, but recent benchmarks we've done have proved that this non-invasive technology can provide accurate results in comparison with gold standard equipments in clinical settings.
So, like when we had COVID,
Yeah.
what role could this have played if it were there?
If this were there, it could have supporting frontline workers in terms of correcting all those vitals and delivering some clinical items that will be used in hospitals. but also improving efficiency in terms of serving many people, because there were a lot of queries where it takes a nurse to around 10 to 30 minutes to correct vitals and record them somewhere, then data entry in a laptop. This can do it within a range of 60 to 90 seconds to correct all those vitals and push them in the electronic medical record at the hospital level, and national level, and global level. We look forward to expand and contribute to health intelligence sector globally. Yeah.
Great job.
Thank you, sir. Thank you.
Yeah, great job. So, are you already commercializing this?
Yes, we have received different orders. We are now preparing those shipments to be sent in US and India, and Nairobi and Nigeria as of now.
How long does it take your organization to come out with this robot?
We spent around a year and 8 months in research and development and validation.
No, but now that you've gotten here and somebody wanted one, how long will it take you to get it ready?
To produce one robot? Yeah, we still have a bit of, we still need more resources to improve our production volume, but as of now, we can produce up to 3 units a week.
3 units?
Yes, 3 units a week. And if we have an opportunity to close some investments, or maybe some strategic partnerships in terms of improving production capacity, we believe we can scale our production volume up to 10 units a week. Because we really have a huge demand. We have around 70 hospitals on our waiting list to use these robots. Yeah.
So how much would one cost on the average?
On the average, production cost of 1 unit, is it okay to disclose it publicly?
What's the cost? And what's probable cost? Can we, if I was a hospital and I wanted one.
To buy one?
Yes.
Okay, yes. We have different customers. For instance, in the US, people are now paying $25,000 per robot. And if you compare it with existing robots that are providing this
kind of service,
assistance services in hospitals, they are around $70,000 to $125,000 US. So it's a very good price for them to pay $25,000. But considering financial constraints here, especially on our continent, we have refined our business model to work with hospitals by licensing them to use the robots. Then we do revenue sharing, relieving that burden of revising. Buying this with an upfront payment. It's a bit challenging for them. So we started discussions with hospitals to really understand how we can best price or position this solution in terms of sustainability at the market and quick adoption. So they are really good with working with us in terms of onboarding their clients to use these robots for vitals and triage process, and then we do revenue sharing.
Oh, great. So you are like a pioneer, and what do you tell young people like you or younger people who have ideas and can make them come true? What is your advice? And with your experience with Timbuktu, what would you suggest to them?
Well, I'm too young to share some advice to my fellow young people, but what I would say is one, identifying the pain point, the pain people are experiencing, and be willing to give all it takes to be problem solvers. Because when we decide to address those pains, that's where we create market opportunities and deliver like impacts, but also metrics of those impacts reflecting on our accounts as well. Because in the end, we need to build businesses, we need to sustain our operations. So it's all about being problem solvers in your field. Find some people who are experiencing some pains and find or a need, and then provide the value that those people will be willing to pay for, but also leaving an impact behind.
Are you going to rest after this?
We are now receiving different suggestions, different proposals. There are these people who were proposing to improve or add some more features in terms of using computer vision to add some MRI functions in this robot so that they can scan and detect more diseases. Yeah. So we really believe after successfully deploying these robots and assessing the impact and scalability, we may consider improving and continuing our research and development to cover different
aspects. So you're not looking
aspects.
at rest anytime soon?
Yeah, we still have a lot of work to do, and we are willing to serve.
Thank you, Claude.
Yeah, thank you so much.
That's a great job you've done.
Yeah, thank you.
I wish you all the luck.
Yeah, thank you.
Every second, every minute, every day, news is breaking, events occur, and there are new developments. At Signature TV, we follow these stories objectively, bringing all sides without bias, explaining the complex issues, breaking down the numbers, and investigating the issues behind the news. Anywhere and everywhere, near or far, wherever the news is, we will be there. Signature TV. News in your pocket.
So I am at the Timbuktu hub in Kigali, and I have the rare privilege to be talking to one of the young startups that are, making this dream of the UNDP and the rest of Africa come true. Elizabeth, you're welcome.
Thank you very much.
So how did you get involved with Timbuktu?
So I got involved with Timbuktu through an application that we did for their first cohort last year. And we got in and they selected top 40. And we had the privilege of being among the top 40. Then they narrowed down to top 15 and we had the privilege as well of being in
Africa?
Yes.
Oh, congratulations.
Thank you very much. Thank you very much.
So what are you bringing to the table? What is this new thing that qualified you to be among the best 15 in Africa?
I want to say it's the fact that we're building for Africa. We're not just building something random, it's something that's actually locally and contextualized to the region in which we practice in. According to WHO, about 1 of every 10 patients is harmed during healthcare from medical errors and unsafe healthcare practices, most of which are linked to training. So that's where we come in. We aim to transform healthcare outcomes through capacity building, both of our healthcare professionals, but also for our institutions. So how do we do that? We offer continuous professional development trainings for our healthcare professionals, and they're also delivered by local healthcare professionals who understand the context of Rwanda, who understand the challenges of infrastructure and all of these different bits. So they're able to provide education that's actually tailor-made to that context. But then we also go an extra mile to make sure that the hospitals are also putting in place standards, procedures, and protocols, and we're making sure we digitalize those. In the previous years, even up to date, most of them are still paper-based, right? So we're making sure that they can have an archiving system that's also digital. So we provide them with onboarding and all of that, and we digitalize their content and documents into a digital platform.
We're going to talk more about that, but tell me, how the Timbuktu program, how has it enabled you? How has it has it supported you to be able to, give life to this dream of yours?
Yes. So Timbuktu has done so many things for us. One of the major things I'd say is connecting us to fellow entrepreneurs. So we've been able to have synergies with people in Nigeria, people in different parts of Africa, right? So we're able to know that the product, or rather the business, doesn't have to be tied to Rwanda. You can expand to Uganda. You can have all these synergies with different other entrepreneurs and also be able to make, expand and all of that. They've also been able to help us financially. They've provided us with financial resources to help us in our scaling and our working on our businesses. They've also given us expert knowledge. They've been able to give us different mentors who walk us through this journey. If it is market scaling that you're looking for, they find someone within that space that can actually help you scale in that way. So it's not just normal generic things that accelerators do, but more contextualized and more localized to what you actually need as a startup.
And it helps with personalizing your needs.
Yes.
So tell me more about what you're doing. How can you scale this up to include, because this is just a hub that has to do with health.
Yes.
And of course you have the fintech hub and all that, but it's expected that as you work in Kigali, that work is scalable to cover the entire continent.
Yes.
So how are you doing that?
Yeah.
Working with UNDP, working with Timbuktu, how are you making that possible?
Yes. One of the main things that is coming up is through the synergies, once again, that you have with fellow entrepreneurs when you're discussing these different things. So you're able to understand that your product could actually be a feature in someone else's product. So we are no longer just selling as individuals, but you can actually link to someone and grow in a bigger way and scale
we can call
better.
that collaboration, partnership.
Yes. We've been able to collaborate and partner with most of the other entrepreneurs and be able to understand even those regions, because how we operate in Rwanda is totally different from how they operate in Uganda. So we're able to know, for example, I that works in accreditation of hospitals, I'm able to know that, how do you do it in Uganda? And they can actually connect you to one or two people, and then you would have an understanding of how it's done in Uganda, so that when you're moving to Uganda, you're not going with a blank space, you're actually going there with a knowledge of how it is done over there. So that is one of the main things that has aided. But also we are tailor-making our solutions not to only fit our local Rwandan population, but they encourage us to, look at other countries, see how things are being done over there. And if you're building, we're not just building the way the Rwandan system is. We make sure to consult other places. How is it being done? How can we centralize? And it comes back to what we've been talking about, making sure that Africa has actually a centralized system of doing things. So that accreditation or continuous professional development in Nigeria shouldn't be so different from that in Rwanda. How can we make our systems more unified? So it's looking at the bigger picture and building with the bigger picture in mind. Yes.
So, with what you are doing, is it possible that at any point in time as you grow, that this work you're doing can cover the entire continent? Is it
That's
a dream?
the hope.
Is that a dream you're...
Yes, absolutely. That's the hope. That's the hope that one day we will not only be training Rwandan professionals, we will be training different professionals. Also, people in Nigeria can learn from people in Rwanda. People in Rwanda can learn from people in Uganda. Building a system where healthcare professionals that understand the African context, we only have a representation of 3% of the global health workforce, right? So if they can learn from each other, and given the setting, the infrastructure, we share most of these similar challenges. So we can build and we can also learn from each other more.
Is there a platform you're using for this where, for instance, I could go to and know that, so hospital in in Kigali
Yes.
is doing well, is accredited, is up to date.
Yes.
A hospital in Uganda, is there a platform, or is there an app, or how do you do it?
So we do that, but we are also, that most of it is covered by governmental bodies. So what we do is we aid them, we work in collaboration with them to actually identify things that come from, usually they'll do surveys around the country, and then through those surveys and through the statistics, we're able to provide now a solution to them. Say, if a hospital can use this, they'll recover ABCD, they'll be able to do this and that, right? And so with that information, we're more collaborators, and we make sure that actually people can actually meet on those platforms. We do have a platform, a unified platform that both does hospital accreditation and also continuous professional development. Yes.
Okay, so yes, Timbuktu has helped you in growing. What were the challenges you've also encountered working with them? Things you think they could have done differently?
Interesting. That's an interesting question. For now, I want to say they're doing really well. I have not encountered a challenge that I'd say is so mighty and big, because even now, we graduated in August, but we're still working in the Timbuktu space. They still fix and find ways for us to get bigger platforms like yourself coming to talk to us, you know. They still push us forward in every way they possibly can. So for now, I'd say maybe another cohort. Let's get more entrepreneurs to experience what we have experienced with Timbuktu. Yes.
So let's look at sustenance. Let's look at, making this program enduring. As a young person who is already benefiting from this opportunity provided by Timbuktu,
yes,
what are your suggestions to make sure that this is enduring, this outlives all of us, and that we're able to achieve the aims of those that thought about this from the beginning?
Yes.
How do you think we should go to make sure?
I think if us as African countries, right, if we found a way to bring ourselves to this table, right, to negotiate with people like Timbuktu, who are not only supporting startups in Rwanda, they're supporting startups in different areas in Africa, we're able to scale more. Because they're not only targeting one scope of people or one area, right? It's covering the entire Africa. So if our governments were more flexible to negotiate with the likes of Timbuktu, I think this could be something that really outlives us, right? It's something that not only will stay in the African context, but we could potentially have really big unicorns come from Africa if they're put on the table.
So you think that government should play more role?
Yes.
Should partner more?
Absolutely.
With organizations like Timbuktu, UNDP,
yeah,
to see how this can be replicated in other areas of African life?
Yes, because we still have accreditation of hospitals in Nigeria. We still have accreditation of hospitals in Ghana, right? So if this is a platform that's able to push such a startup forward, and it covers that, we'll have a centralized system in no time, which is currently the issue. We find that I'll still be a licensed startup in Rwanda, but if I move to another country, I have to start from scratch again. This could actually be that flagship that is, when you're in Timbuktu, you're actually certified to work in all of those, different countries. That could be something that could potentially outlive all of us.
Elizabeth, thank you for your time.
Thank you for having me.
I wish you all the luck.
Thank you very much.
Remember, you young ones are the future of Africa.
Thank you.
So don't take it for granted.
No, we're not.
Every second, every minute, every day, news is breaking, events occur, and there are new developments. At Signature TV, we follow these stories objectively, bringing all sides without bias, explaining the complex issues, breaking down the numbers, and investigating the issues behind the news. Anywhere and everywhere, near or far, wherever the news is, we will be there. Signature TV. News in your pocket.